Thank you all for joining our webinar today titled The Political and Legal Determinants of Health. My name is Tom Pryor. I'm a lead senior staff attorney here at the Public Health Law Center, and we're very lucky to be joined today by panelists Dawn Hunter and Professor Micah Berman. Dawn is going to be explaining the connection between civic health and public health and discuss how the new administration's policies will impact both. And Professor Berman will analyze what the change in the administration will mean for the courts and litigation over public health issues. And both of these panelists will be providing guidance for public health professionals who are looking to navigate this new political and legal environment. Now, this webinar is brought to you by the Act for Public Health, which is an initiative of the Public Health Law Partnership, a group of organizations and experts applying their decades of experience in public health law and policy work to address challenges in public health authority and infrastructure. As I mentioned, I'm with the Public Health Law Center, which is one of the partnership organizations and is located at the Mitchell-Hamlin School of Law in St. Paul, Minnesota. And I want to begin by acknowledging that we are on the indigenous homelands of the Dakota people, also known as the Sioux Nation, and that 4 federally recognized Dakota tribal nations remain in this area. We appreciate their ongoing stewardship, spiritual connections, and the lifeways that they've developed in these homelands upon which the law school sits. A little bit more about the Public Health Law Center. We offer free legal technical assistance to all communities, public health advocates, and other partners. We also publish widely on public health issues and offer trainings and webinars like this one. We do not, however, offer direct legal representation, nor do we lobby. At the center, we pursue health equity. Equity is about giving people what they need, which includes understanding barriers, circumstances, and conditions. And effective public health policies must provide benefits to everyone. Research also shows that comprehensive public health policies are best, especially policies that consider the social determinants of health, the network of policies and factors from housing to education to the criminal justice system that impacts people's health and happiness. Now, this webinar is specifically a product of the Public Health Infrastructure team at the center. The PHI team is a new venture within the center, supplementing work being done by our commercial tobacco control team, our healthy eating and active living team, and our climate justice team. Now, whereas those groups focus on important substantive areas within public health law, the Public Health Infrastructure team works to provide legal and policy capacity building assistance to public health managers and other public health professionals across substantive areas. It tackles foundational legal questions about public health authority and provides training and tools so that public health professionals have the legal knowledge, skills, and abilities to advance equitable public health policies. Its core areas of work include, as I mentioned, public health authority, including questions of preemption, legal capacity, including trainings on basic legal issues as they relate to public health, intergovernmental coordination, including work on data use agreements, and equity-informed policy. One thing that the Public Health Infrastructure shares in common with the other teams at the center is that we provide free legal technical assistance to public health professionals, and we're especially soliciting requests for TA on data use agreements. So if you have questions about that or other topics, please do contact us at the information listed here. And we're very lucky today, as I mentioned, to be joined by 2 amazing speakers and experienced public health professionals. Micah Berman is a professor of health services management and policy at The Ohio State University's College of Public Health and professor of law at The Ohio State University's Michael E. Moritz College of Law. His research explores the intersection between public health and legal doctrine, and he is a nationally recognized expert in tobacco law and policy, having served as a senior advisor for the FDA Center for Tobacco Products and publishing extensively in the area of commercial tobacco control. Before joining Ohio State, Micah established and directed policy centers in Ohio and Massachusetts that developed innovative model ordinances and provided policy support to state and local public health programs. Dawn Hunter is the founder and CEO of The Dawn Loud, a boutique consulting firm dedicated to designing equitable, inclusive public health policies and practices. She collaborates with public health agencies, community-based organizations, and academic institutions to create innovative solutions that operationalize health equity and foster community power building. Her work includes research and analysis of legal and public health data impacting health equity, facilitation of capacity building workshops, and training on a range of public health topics, including advocacy, ethics, and value-based messaging. And she is the lead author of the Health and Democracy Index, a resource that compares public health indicators and voter turnout to the restrictiveness of voting policies in each state. Now, here's our agenda for today. Professor Berman is going to kick us off by discussing the courts and public health, and then we'll hear from Dawn, who will discuss the interplay between civic health and public health. And while our speakers are presenting, I'll be following any questions raised in the chat and providing some answers and resources as appropriate. We're going to try to address any and all questions then during our moderated panel discussion open Q&A session at the end. But if we're unable to get to your question during this presentation, please do contact us at the information we'll supply at the end, and we can provide you with more guidance in TA. And with that, I'm going to stop sharing my slides and kick things over to Professor Berman. Thanks very much.
Thanks, Tom. I will get my slides up. All right. Well, thanks so much for joining. I'm just watching the participant number tick up and really grateful that everyone's taking the time to join today. There is, of course, a lot going on. It is hard to keep up with. It's exhausting to keep up with. I'm going to try to give you a presentation that looks at the bigger picture, so hopefully it will not be out of date in a couple days, but we'll see. I'll start just with a quick disclaimer that this is not legal advice, and these are only my personal opinions and not those of my employer or any other entity. So I just wanted to start with a few things that I felt needed to be said. First, just wanted to acknowledge that it is just, I think, a painful time for the field of public health, with that pain falling more directly on some than on others. But for everyone experiencing that, I'm sorry. And in particular, to those of you who are just entering the field of public health, it is a tough time to be coming into the field. The layoffs at the federal government level have fallen most heavily on people who are just entering the field, potentially including some of the people on this call. And so for people who are just trying to get their footing in public health, just wanted to acknowledge that this is a difficult time for that, and that there are lots of people out there, including on this call, who appreciate your skills and your commitment and your knowledge and really want you to be part of the public health world and stay connected to public health, and are going to do our best to help you do that. And then for everyone, particularly those people in states where there are attacks on public health coming from both the state level and the federal level, I just, again, want to say that I'm sorry that your work is being disrespected and really hurtful and sometimes hateful ways. And so, my words don't help with that so much, but I just wanted to say thank you to all of you for the work that you do. I'm really glad that so many people have joined today, and I think that shows the need for us to keep connecting with and supporting each other. And then, final preliminary thought is, things often seem overwhelming, as I said, but the work continues, and I think it is really, really important to take the time to assess what is happening and think strategically about where we go from here, what the priorities are over the next year, over the next 4 years, and beyond. So I certainly don't have the answers about how to do that, but I just wanted to start with some general points. One is that not all bad things are illegal. So, for example, the president nominating and the Senate confirming the country's leading anti-vaccine crusader to be the Secretary of Health and Human Services is frankly mind-blowing, but it is not illegal. That secretary going on to say false things about vaccines, as he did this past week on Fox News, is and will be incredibly frustrating and dangerous, but not necessarily illegal. And so there's not a remedy in the courts for that. And so, there are a lot of things that are going to be potentially problematic for public health, some problematic policies and problematic statements. It doesn't mean that there's a response in the courts to that. I also just wanted to note on that example that highlighting that the Secretary of Health and Human Services has for years been himself a leading source of vaccine misinformation is not a partisan statement. It is just a fact. And I think it's just really, really important to note that if we censor what we say because the facts are inconvenient for one political party or the other political party, then we're not being nonpartisan. And, as we've seen, any issue can become more politically polarized. But if we stop talking about vaccines, for example, because views on vaccines have become politically polarized, then I think we as a field have really lost our way. And so we need to be really, really careful not to do that. Second, not all policies and practices should be defended. I'm not going to belabor this point, but both as a matter of policy and as a matter of strategy, not everything that public health agencies or public health entities have done in the past should be defended, even when it was a very valuable thing to do. My advice here is just to kind of take a breath and make sure that we're picking the right fights, because there are going to be lots and lots of fights that are worth having. And then third, even with the law on your side, litigation is not always the best option. It is slow, it is expensive, it is time consuming, it is unpredictable. The courts are not always friendly to public health. So litigation is sometimes very important, it's sometimes unavoidable. But again, it's worth taking a breath and thinking about in any particular case whether litigation is the best options or whether there are other alternatives where we should be focusing our energy. And then finally, the federal administration changed. The values underlying public health did not, or at least should not. I've been disappointed. I suspect a lot of you have been disappointed in a lot of institutions that have walked away from what they said were their values over the last month or two. Public health should not be doing that. We should be rooted in facts, facts about public health, facts about what is actually happening, rooted in the law, rooted in the communities that we are serving, committed to treating everyone with respect, committed to health equity, and committed to ensuring that everyone has the opportunity and the capacity to live healthy and fulfilling lives. So those values should be guiding any decisions, including decisions about what to pursue in the courts. So to the news. This is hopefully not stressing people out too much, but this is, of course, just the tip of the iceberg. And I won't, of course, go through all these, but just wanted to say that this time is different from the last Trump administration. The threats to public health are different in type, in scope, in scale. There's the DOJ-led or DOJ-directed cuts to the government workforce. There are important public health programs that are being canceled or having their payment system shut down. There's the isolation from the world and global public health efforts, including the WHO withdrawal. There are data sets disappearing, data collection efforts being halted, which I think is very, very worrying and could do a whole other webinar about that. There's this culture of fear and rollback of civil rights progress and attacks on the very idea of health equity or environmental justice, and so much more. So, I think probably most of you on this call know the evidence. I'm not going to belabor the public health harm because we know that discrimination is bad for health, that inequity is bad for health, that fear is bad for health, that ignoring climate change and its consequences is bad for health, that corruption and government capture is bad for health. All of these things are bad for public health. So the news is not good for public health right now. So there is pushback happening in the courts. In terms of the courts, I can answer questions more broadly about public health litigation, but I just want to focus in for these purposes on challenges to what the Trump administration is doing. And just wanted to mention that for people who are interested in following that, there are lots of groups that are trying to collect information about that and track it, but just to point you in to a couple of them. One is the Civil Rights Litigation Clearinghouse that's run by the University of Michigan. Another is Just Security, which is run out of NYU. Both of these, I think, are doing a really good job of tracking litigation, but also collecting all the relevant documents. So for attorneys in particular, it's a really, really good source of what is going on. Just Security, as of this morning, has 114 different cases that they're tracking, only one of which is closed, the other 113 of which are still ongoing. And there are more than 40 injunctions that have been issued already with respect to different actions of the Trump administration. This is, I thought, was really interesting. Professor Christina Pagel, I don't know if I'm saying that right, who's actually in the UK, created this image to look at what is being challenged and who is challenging it. And I think we're in this environment where there is hesitancy to step out and be the plaintiff. Because you are going to get a lot of pushback and hate, frankly, targeted your way if you do, and potential retribution. And so there's hesitancy to do that, which is very, very understandable. There's now law firms and lawyers being targeted as well, which I think is really, really troubling. And so you can see that a lot of these lawsuits are, and I think appropriately are, being brought by organizations, associations, labor unions, collective entities, organizations that represent lots of different individual entities. I think that is appropriate and really important, and I'm grateful to the groups that are doing that in important cases, including the American Public Health Association, which is the plaintiff in two of these cases. On the lawyer side, Democracy Forward and the broader Democracy 2025 coalition is behind a lot of this litigation. So that's an entity that people might be less familiar with, that is really at the center of a lot of this. You can see that states also, AGs, attorneys general in blue states are also bringing some of this litigation as well. I'm gonna shift to law professor mode for a second. And just looking at the big picture, I think there are legal issues that are taking center stage, both in public health litigation more generally and in these challenges to Trump administration actions that are not new legal issues, but they are becoming more central to public health than they have been in the past. And so I think there's a need for theorizing and discussing and coordinating about how to address them. My time is running short already, so I'm going to try to be really quick, but just say, these are some of them. So, equal protection has been a tool, although not always an effective one, to promote health equity. But in the Students for Fair Admission versus Harvard case, Justice Sotomayor in the dissent, so this was the case about university admissions, affirmative action in university admissions. And Justice Sotomayor in dissent said that the court's approach, quote, turns the 14th Amendment's equal protection guarantee on its head, end quote, by essentially making it impossible to consider and respond to the way that racial discrimination has and continues to operate in the real world. And that has huge implications for public health, as I'll get to again in a second. Due process clause, the Dobbs decision overturning Roe versus Wade throws a lot of due process jurisprudence up into the air. Both equal protection and due process are really at the core of pending cases, including challenges to Trump administration actions about transgender rights and gender affirming care. Speech, First Amendment speech issues on the non-commercial speech side, I think is increasingly really, really important. The Trump administration executive orders about DEI are essentially trying to outlaw disfavored terms, which executive orders can't do, so that's a separate issue, but also raises huge, huge First Amendment issues. And then there are spending clause issues about how much the federal government can or can't pressure local governments to follow its policy preferences. That that conditional spending has been a really important tool for public health in the past, but now it's being used in the other way to pressure states in ways that are likely to be harmful to public health. So I think on all these issues, there are really difficult ethical and strategic questions about how to engage with problematic legal doctrine, particularly problematic Supreme Court cases, and I mean problematic from a public health perspective. Um, and then I think there are also questions about what a consistent and principled public health position is on some of these topics that public health scholars have maybe paid a little bit less attention to in the past because these issues were not as central. So just to talk about one issue really quickly, this is the Dear Colleague letter that you might have heard referenced um, that was sent from the Department of Education, Office of Civil Rights, um, intended to reinforce and build on one of President Trump's executive orders. And what it says, you can see in the first sentence, it says, there's just an excerpt of it, educational institutions have toxically indoctrinated students with the false premise that the United States is built on systemic and structural racism and advanced discriminatory policies and practices. Um, and it goes on to suggest that anything attempting to address systemic and structural racism uh, is potentially illegal, and that educational institutions might be putting their federal funding at risk if they continue DEI programming of various sorts. I mean, I think it's written in kind of legally somewhat slippery ways, but that was the clear implicit threat that it was communicating. And so many educational institutions, including my own, have already started rolling back various programs. And I think you can have a debate about the role of systemic and structural racism. You can have a debate about whether certain DEI initiatives have been productive and have advanced the goals as they intended to, but to suggest that those programs violate the Equal Protection Clause because of the Students for Fair Admissions case, which is essentially the argument that this letter is making, um, is a huge stretch and not what the case said. Um, and of course, it also raises really big First Amendment issues, as I suggested. And so this is being communicated essentially as legal fact when it really is not. And so this is in the educational context, but I think with respect to public health agencies too, I think it's really, really critical to stand up to threats like this that are trying to use what I think at least is a misreading of the law to impose policy preferences that the federal government just does not have the legal authority to impose. So what to do about it? A lot of these are related, but I'm going to try to tick through these quickly. And again, happy to discuss more. One is internal advocacy. So advocacy within your organization, particularly pushing back against pre-compliance with directives that have very shaky legal foundations. So sharing information about what the law really is, what the law says and what the law doesn't say, I think is really, really important. Thinking about legal preparedness and support. So rather than stopping important programs, thinking about how to defend them legally if necessary. Second, tracking the impact that various actions of the administration are having. If you've been personally impacted, Democracy Forward has a portal on its website where you can share some information about that. If you have the capacity organizationally to do data collection where the federal government is now stepping away from doing it to actually show the public health impact of ending certain programs, for example, I think that is absolutely critical. And then rebuilding that surveillance infrastructure over the short, medium, and long term is going to be incredibly important. But then also communicating that back where appropriate to the people involved in these lawsuits. Communicating with reporters, this is a bit external to litigation, but I think makes a huge difference in how the public feels about these cases. So That is another option if you have information that you think reporters are not don't have access to or aren't thinking about. Amicus briefs. This is where I would kind of think about your organization's added value. So what are you the expert in? What information do you have that is not before the court, where an amicus brief, a friend of the court brief, could really be relevant? You don't have to get involved in all or even many cases, but there might be one or two cases where your perspective might be important and might be missing from the conversation. Affirmative litigation, so that's all these lawsuits that I was talking about, where you can and where you think it's appropriate, encouraging the organizations and associations that you're involved with to bring litigation or get involved in litigation. I think different people are differently positioned, but overall, I think it is just really, really important to be standing up and speaking out. For people still in government. I think we've already seen that loudly refusing to go along with illegal orders can be really, really important and impactful. But in general, I think it's important to speak up, not just for public health, but for the rule of law, for those getting targeted for their viewpoints, whether or not you agree with those viewpoints, for people representing lawyers who are representing clients, again, whether or not you agree with those clients, and also standing up for judges who are being targeted for the opinions that they've written. You can, of course, and should disagree when you think a legal opinion is wrong, but threatening judges, threatening their families is certainly never acceptable. I'm already at time, so I'm going to go real quickly and say, Democracy Forward is doing great work on protecting democracy. Right now, there's a lot of overlap between that and public health. But I think going forward, we need to be thinking about something like a public health defense fund, where we can actually have lawyers with the capacity to defend clients or bring litigation to address broader legal issues that impact public health, to defend state and local public health policies, to compel compliance with federal laws and regulations, and defend laws and regulations when the administration won't, and to identify and develop state and local policies to fill federal gaps. So it's great. I think the public health infrastructure team is much needed. I'm glad they're doing some of this. I think for any funders out there, there's a lot more that could be done, and happy to talk a lot more about that. And I think we've seen over the past few years, those opposed to public health measures have actually done this really, really well, both defending states that have passed aggressive abortion bans, for example, or other laws that harm public health, and offensively suing lots and lots of employers over vaccine requirements or DEI initiatives or other things. I think that has been really impactful in changing the law in directions that are, I think, overall not great for public health. So finally, just hard to find optimism. But I just wanted to share this quote from my co-author, Scott Burris, who I'm sure many of you know, that there are a lot of challenges, but that challenges also mean new opportunities. And law can be really, really important in helping to create a more just and fair and healthy society. It is harder to build things back up than it is to tear them down, but I think this moment does give us a chance to rethink what public health is and what it can be, and to hopefully bring the public along with us as we do that. And so, law is one part of that, but it won't happen on its own. It's going to require a lot of other things as well, including all of the things that Dawn is about to talk about. So I will stop there and turn it over to her.
Thanks, Professor Berman. I am going to share my screen. Oh, actually, let me stop share and make sure I clicked share audio, because I have a short clip at the end that I want to make sure that you can hear. Oh, I cannot share audio. That's okay. I'm going to show it because the video is very impactful. So I'm really glad to be here. I may go off camera. I have, had a fun day of tech challenges, but I want to start by thanking the Public Health Law Center for the opportunity to be part of this today, and loved everything that Professor Berman was just sharing, especially the action and the optimism, and I hope to build on that in my time. I also want you to know that I'm coming at this from a place of both personal and professional challenge. So I am an independent consultant. A lot of what is happening affects me as somebody who practices in the DEI space. Um, and then also, of course, it just creates challenge for me as somebody who's very active in my community. And what I hope to do is build on what you heard about the context and talk about what it looks like on the ground and in the communities that we live in and how we respond. Okay, so I want to start with what's your why? And I might go through some of this quickly because I know we have a lot of questions and I want to make sure that we get to those. But these are images of me doing things, working election protection, on the Votes for Women trail, out protesting, and basically any opportunity I see where there's a picture about voting, I'm in it. And I wanted to share this because I think it's important to understand what your why is in this moment and how that can help you not to feel helpless. What is a thing that you are passionate about? What are you most passionate about? And that is also within your sphere of influence. It can be very overwhelming to think about all of the things that need to happen. But, as individuals, we aren't responsible for everything. So really hone in on the one thing that you are passionate about and you can do. Understanding your why is also really important because it also helps us to know how we can relate to other people who we disagree with. And that's why I shared this particular slide, because one of the ways that we relate to people is understanding our own values and beliefs, and then endeavoring to understand the values and beliefs of others. And we have law, policy, and process and programs. Those are things that are rooted, though, in our perceptions, our traditions, our norms, and values. And that is what drives our behavior. And especially it drives organizational behavior and behavior within systems. And I want to focus on perceptions and norms because these inform the dominant narrative. And a dominant narrative is a narrative that is a widely accepted story or perspective that is frequently repeated in a society, and it often reflects the viewpoints of people in power and shapes how people understand a particular issue or event, and it frequently marginalizes the experiences of less privileged groups. And that shifting narrative is something that we can do that helps to build community power. So we have to know what the dominant narrative is, and then we want to shift that narrative to build community power. Not just how we talk about things, but also shifting our perspectives, our own perspectives, not engaging in conversation to try to shift other people's perspectives, but to understand them, and then to challenge and change our norms. And today I'll also emphasize at various points the importance of acting collectively, shifting power to communities and localities, and relationship building. And this slide is credit to partners I work with at Health Resources in Action, adapted from the Lead Local Glossary. You may be familiar with this particular image. I love our partners at County Health Rankings and Reports, and this is from the National Findings Report. County Health Rankings and Roadmaps. This is from the National Findings Report for 2024. And I want to argue that building community power starts with a foundation and understanding what creates our idea of community and how power is exercised. This is a graphic, again, that explores what is civic infrastructure and civic participation. You should see a library, there's a city hall, there's a grocery store, there's a playground, there are signs that say vote here and volunteers needed. This really captures both civic infrastructure and civic participation. And in a nutshell, civic participation and civic infrastructure provide us spaces to connect, to learn, and to collectively act. It establishes governance and it provides resources, and it creates and facilitates social networks and shared culture. I'm not going to stay here long. If you're familiar with the Health and Democracy Index, you probably already know some of this, but I just want to highlight, it's important to know that there is a consistent research evidence-based association between civic and voter participation and health. So in states where it's easier to vote, there are better rates of self-reported health at the state level. In states where it's easier to vote, there are lower uninsured rates. Counties and states where it's easier to vote have lower pre-vaccine COVID case and mortality rates. And one of the more important ones, that was the third bullet, and one of the more important ones, or they're all really important, is that civic engagement and youth is positively associated with better future income, higher education levels, and better mental health compared to non-voters over the course of their lifespan. And so civic health refers to the state of a community's well-being and its ability to address public issues and improve the lives of its residents. And this takes into account levels of civic engagement, social capital, organizational or institutional capacity, and civic infrastructure. And it's shaped by all the things on this slide. I won't read them all. I will say I'm going to talk more about advocacy and advocate for engaging with your neighbors, among all the other things here. But they also include volunteering and mentoring. And you may be familiar with this. This is, of course, lead author was Scott Burris, who you've already heard mentioned, but this is the 5 Essential Public Health Law Services. And this is a great framework that I always like to share. This particular reference is from Public Health Reports in 2016. And I want to focus on one of the 5, and that is engaging communities and building political will. And that's what I like to say is advocacy. And so one of the things I share is, what is advocacy? How do we expand on what that means? And for me, it's all of the things here: establishing priorities and establishing shared agendas and shared values, educating our community members, our friends, our neighbors, our policymakers, equipping people with the tools to act, mobilizing people toward action, resourcing action in communities, evaluating whether or not it made a difference, and holding decision makers accountable. These are all ways that we can engage in advocacy. And so one of the things I want to talk about is civic engagement via ballot initiative or referendum. And so this is a map from Ballotpedia. Citizen initiative process is basically where you can vote on constitutional amendments on the ballot. And then referendum process is to approve or repeal an act of the legislature. 26 states, so just over half the states, have such a process. I live in the state of Florida. There is an effort here, I think it's House Bill 2014, I could have the number wrong, that is attempting to limit that process here. And that's a real challenge, because I think in our current environment, where states have this capacity, it is an important and powerful tool to affect change. But even where states don't have that capacity, don't have a citizen initiative or referendum process, we can still learn the organizing lessons to effect change. And so I want to talk briefly about some ballot initiative and referendum wins in 2024. I know a couple of the questions that came in advance were related to, what are the bright spots? Well, I would say at the local level, there were a lot of bright spots. Abortion rights, drug policy, criminal justice and policing, labor, transportation, education, and housing were among many issues that were decided by initiative or referendum in this last election. And I've shared this particular slide if you've been on a training with me or a workshop with me before, just giving a few examples related to protecting or restricting abortion rights or reproductive health care, decriminalizing possession of small amounts of marijuana, removing the slavery cause to reduce forced prison labor, increasing the minimum wage and ensuring paid sick leave, funding public transit, and providing funding for affordable housing. Well, I hope what you can see here is that green is yes, so these are things that passed or succeeded, and red is no, and there's more green than red. So we really had a lot of successes that I think are worth lifting up in all of these areas. Protecting abortion rights in Arizona, Colorado, Maryland, Missouri, Montana, Nevada, New York, and San Francisco. Decriminalizing possession of small amounts of marijuana in Dallas, Texas. Labor, increasing minimum wage and ensuring paid sick leave in Alaska, in Missouri, in Nebraska. Flagstaff, Maricopa County, San Francisco, Columbus, Ohio, Nashville, money for public transit, and then affordable housing. Most of those passed as well. And so I think it's really important that we think about, what are our tools locally to ensure that public health is protected. And these are just some examples and some wins that we don't want to forget in the big picture that does seem very kind of doom and gloom heavy. at the moment. There were also a lot of questions that came in about rural impacts. And so I wanted to share this particular, an image from this particular article. The citation is on the slide. This is excess death rates for Republican and Democratic registered voters in Florida and Ohio, two very conservative states during the COVID-19 pandemic. And basically what the researchers found was that in the period after open vaccine eligibility from April to December of 2021, there was a clear difference between Republican and Democratic voters, with higher excess death rates for Republicans in counties with lower overall vaccination rates. And what they concluded, among other things, is that these results suggest that well-documented differences in vaccination attitudes and uptake between Republican and Democratic voters may have been factors in both the severity and trajectory of the pandemic. That may not be news to people, but that's why I started out this presentation talking about perceptions and norms and values and traditions, because they absolutely affect our uptake of public health interventions and programs. And we have to think about those upstream structural factors also that influence the conditions in rural counties that affect whether or not people are open to public health and open to those interventions and open to engaging with what we think makes communities healthier. And there was also a question that was specifically related to the funding freeze. And so what I wanted to point out is that while things are kind of in flux, we're seeing an impact, I think, both in investments in terms of actual money flowing to communities and in infrastructure. So some brief examples are the Bipartisan Infrastructure Law, Inflation Reduction Act, and CHIPS and Science Act. I wanted to point out that under the CHIPS and Science Act, that is funding regional technology and innovation hubs or tech hubs and rural STEM education and research. So that's a big blow to those communities. The Solar for All program has been paused, which is affecting rural communities in the Southeast, and it affects tribal communities that were receiving those funds or going to receive those funds. And while some money has already been allocated to the states and just needs to be distributed, some funds have not been, and now there's confusion about what do we do with the money that's already been allocated and how do we make decisions about it. And then on the infrastructure side, USDA Rural Development and HUD both are responsible for housing in communities. And HUD also is an important partner in disaster relief, particularly in rebuilding in areas impacted by a disaster. And this affects rural communities heavily. And so these are some significant rural impacts that are distinct from other locations in urban areas. This is just a quote from the Institute of Medicine, Future of Public Health. The thing I want to emphasize here is that public health is what we do collectively to assure the conditions in which all people can be healthy. This is what drives me as a professional and as a person. And I wanted to share, this is a photo I took. I gave a speech in San Antonio with San Antonio Metro Health at their Quality Improvement Forum. And I went wandering around San Antonio and I stumbled into Labor Plaza, and it uplifts local labor leaders and their contributions to San Antonio history. And this one says, after attending my first union meeting and raising the need for air-conditioned schools, a leader saw something in me that I didn't see in myself. I wanted to equally inspire others, helping them to see their power to create change through collective action. I tell you what, I could not love this more because it speaks to the heart of who I am as a human being. But I also think it really calls attention to important things in this moment, the importance of collective bargaining, the importance of people stepping into leadership positions, and the important role that each of us plays in helping to uplift other people and help other people feel empowered to step into leadership roles as well, and seeing that all of us have the ability to affect change. And again, I call you back to, what is your why? What is the thing that you're passionate about and that you can influence? So I'm going to end in just about 2 minutes with some strategies to do that. I won't read all of these because you are going to get these slides, but strategies at the individual level, and I want to emphasize volunteering in your community right now, expanding your connections. I think there's nothing more important that we can do right now than making sure that we expand our circles. We're not talking about confirmation bias today, but confirmation bias is our tendency to seek out information that reinforces what we already believe. It is really exacerbated in today's modern kind of social media environment. And I like to quote Jonathan Haidt, and he says, the most reliable cure for confirmation bias is interacting with people who don't share your beliefs. And that's also how we build a stronger sense of community. Organizations also have a role here. I'm going to highlight the third bullet on this screen on the right, which is use your power to fund, convene, connect, and otherwise facilitate local, I said local twice, local, regional, and statewide action. I'm especially talking to local philanthropy here. If you have money, we have over 300 health conversion foundations in this country with more than $40 billion in assets. Now's the time to step up, not just continue to fund things the way you've been funding them, but really think about your role in facilitating local change. Especially because we're seeing that power is going to, and change is going to happen at the state and local level. Speaking of which, state and local level support public institutions and build coalitions that facilitate partnerships to strengthen civic life. And at the national level, we just saw the John Lewis Voting Rights Act has been reintroduced. That really is something that would be impactful should it pass. And it's important that we continue to make that effort, even if the barriers are high for it to pass. And then finally, I want to just talk about navigating a new world as individuals. It's important that we accept change and that we see the opportunity. I hear a lot of people say, how do we stop what's happening? Maybe we don't necessarily stop what's happening, and maybe it's not within our power to do that, but it is within our power to see that change is happening and to see where there are opportunities for us to step in and maybe create a new kind of public health and a new legal landscape. We need to connect with new people. We need to read for leisure. I shared an article recently from the Young Lawyers Division of the American Bar Association. Reading is important because it helps us to empathize with other people and connect with other people's viewpoints and understand people who aren't like us. And it can be easy to get lost in the news. Try not to. And related to that, support local journalism and the arts. Democracy, I think it's Democracy Now! Has articles about the importance of local journalism. In communities where local journalism is strong, voter turnout is higher and democracy is stronger. It is really important that you think about how you're supporting your local newspapers, your local public radio stations, etc. Set boundaries around your time, your energy, your emotions. That's going to look different for each of us, but really do what works for you. And that may mean cutting off the news. That may be cutting off people in your life. That may be reevaluating where you work, but whatever it is, set boundaries. Engage in a way that is meaningful to you. I just want to reinforce that point again. And then I also want to end on commit to joy. I was at a meeting recently, and I strongly believe somebody else said this, but this is also my heart, is joy is the resistance right now. The intent is to overwhelm us. The intent is to make us angry. The intent is to get us distracted from our lives and not to be focusing on those things that help us to build power and to strengthen our relationships with each other. So I would encourage you to think about how you can commit to finding joy every day. I wanted to share one last thing with you. I'm not sure if I can share the audio, but this is from, and because I don't think I can share the audio is going to play, I will talk over it while it plays. Let's see if that works. Oh, it is going to play.
Whoa,
Can you hear it?
All the way. Double rainbow. Oh my God. It's a double rainbow all the way. Whoa, that's so intense. Whoa, man. Wow. Whoa. Whoa. Whoa! Oh my God! Oh my God! Oh, oh my God! Whoa! Oh my! Wow! Woo! Yeah! Oh my! Oh my!
Oh, is it gonna let me?
Double red.
Oh, like it just wants me to keep playing the double rainbow. Let me see if I can keep going forward. I might have to skip to the end. I wasn't gonna play the whole clip, so let me see. Let me just do it like this. Okay, now let's see if it will go forward. No, still doesn't want to. So let me get out of that because I didn't have any others. I didn't have any other slides anyways. Let me stop sharing and say that I shared that because Hidden Brain is one of my favorite podcasts, and there's an episode where Shankar Vedantam talks about finding awe, and I would encourage you to not forget that when you're out walking your dog, when you're out having dinner with your friends, look for the things that are joyful and beautiful around you. That is how we find a sense of purpose and connection to the world around us, and we can stay grounded in difficult times. I probably went a couple of minutes over and look forward to the short time that we have for questions, and really excited to be here today.
Thank you so much, Dawn and Micah. I love that video as well. It's been a while, so thanks for bringing that back across our radars. Right up there with the guy in the ocean spray on the scooter. So, well, hey, so at the risk of bringing things back to the mundane and the somewhat depressing, I'm going to ask a couple questions to both of you, and we'll try to end on a high note. We'll find something in here to come back to this really positive and proactive and pragmatic advice that you've been giving us all. But I'm going to start with Professor Berman, if I may. And I know, just skipping to one of the big questions that we got to make sure we have time for it, some folks asked in advance of the webinar, what you think might happen or what the implication would be if the Trump administration ignores a court order. So if you can kind of walk us through that and what we should be thinking about if and when that happens.
Well, I mean, I think ignoring a court order could mean a lot of different things. And I mean, there's a lot of discussion about constitutional crisis and whether we're in a constitutional crisis, which I think is not super helpful because that's not a term that has a definition. So I think we've already seen a lot of pushing on the edges of what the courts are saying. So, for example, one of the first injunctions was about the OMB memo telling federal agencies to freeze funding for a period of time. And at least what the reporting suggests is the OMB memo was withdrawn in an attempt to moot the lawsuit, but then essentially the same message was communicated out to agencies that they should actually do that same freeze. In the USAID litigation, there was an injunction issued basically saying that USAID had to fulfill its contractual obligations for work that had already been done. And again, the reporting would suggest that well, they said, well, the contractual obligations have like other ways that we can avoid paying. And so I think there's been a sort of legalistic attempt to find the loopholes in injunctions that have been issued, or find ways around court orders. So it's pushing at what the courts are doing, but I think it's a relatively speaking good sign that it is not sort of a direct statement that the administration is not going to comply with a court order. If we get to that point, I think that would be much more worrisome, but I do think it is also important to keep the pressure on and point out where the administration is working around court orders that have already been issued. And I'll just finally say, this is not the question that you asked, but I mean, it is, I think, in some respects, a constitutional crisis, to use that unhelpful term, for the executive branch to essentially be doing the work of the legislative branch and deciding which policies it's going to implement or not implement. And that itself is really troubling to the basic structure of our government, and even putting the courts out of it. So I think there are kind of lots of gradations depending on the specifics. And I know that's not a super helpful answer, but I think it's important to just kind of be paying attention to the different ways in which the administration is talking about what the courts are doing.
Yeah, I appreciate that. Thank you. And part of what I'm hearing and what I think about as well from your answer is distinguishing between creative noncompliance and direct noncompliance. Both can be troubling, but maybe to different degrees. And so keeping in mind what both of you have said, trying to keep perspective and not treating everything as a 5-alarm emergency is probably going to be helpful for our personal health and safety and emotional well-being, but also being persuasive and effective advocates. So thank you for that answer. Switching to Dawn then, in the last couple of minutes we have left, I know a lot of what you were discussing and emphasizing was the importance of acting local. and what we can do in our local communities. I wonder if you can talk about some of the challenges to acting locally. And in particular, I know one thing a lot of folks track is preemption. Do you see anything coming down the pipeline or trends that you've been tracking on preemption that you can share with folks?
Yeah, I'll try to be as brief as possible. So, when I think about abusive preemption, it's the misuse of preemption, right? Where a higher level of government is restricting action at a lower level of government that is in a way that undermines local authority and harms specific groups of people, right? And so I think there are some trends that we can expect to see. I do think on kind of the negative side is that we're going to see more, I think, preemption of really important protections around environmental health and local environmental regulations, housing perhaps and tenant protections, and worker rights and protections. On the flip side, though, I think that some of the opportunities that we have are really related to some states really saying we're going to set a floor, right? We're going to set minimum standards for, health, worker safety, employment, et cetera, in our states. Um, there's a lot of local backlash right now. That's really key because I think that we will see people push more for things like home rule authority. I think also to speak to this, your previous point and to Professor Berman's point, like creative policy workarounds, right? We're being forced to say, well, how do we find the loopholes and make them work for us at the local level? Also, I think this is a really prime opportunity for mobilizing nationally. And if anything, I see state, local movements increasing in the near term for sure. And then over the next couple of years, I think people are feeling really energized. They're feeling a lot of emotions, not just energized, and can leverage those to put pressure on their local elected officials and decision makers to help keep some protections in place or to push for action at their state that maybe they haven't been engaged in before.
Thanks, appreciate that. And it's kind of a connection between both of your parts of this presentation, acting locally within your community to create those local connections and that connection between civic health and public health, but also some of that happening through the courts and through litigation to challenge abusive preemption. And so looking for opportunities where we can be impactful in both of those ways. I appreciate that. And I just, with the brief time we have left, do either of you want to bring us back to that elevated positive point and maybe leave us with something hopeful that you've been tracking to before I go into the final spiel? I sprung that on you. I apologize.
For me, I'm hopeful. I see a lot of organizing in my own state. Florida is a state where we have become a conservative vote sink, as they say. I see still a lot of people coming together to act. And I also see that we're starting to see a little bit more of crossing political divides. Somebody put Braver Angels in the chat. Great organization that does exactly promotes that, right? Bridging divides between political parties. And I think it's really important that we try to implement those things in our own communities as well, wherever you live. Connect, connect, connect.
Thank you so much. Well, thank you both for your participation in this webinar. Really do appreciate it. I'm going to try to share my screen so you can all have our contact information as we work out here. So you can get more information about the Act for Public Health at the website listed here, where you can access resources, sign up for events, and request legal technical assistance. And of course, more information is available about the Public Health Law Center at any of these resources listed here. If you have questions that we didn't get to, please do reach out either to the Act for Public Health, which again is promoting this webinar, or to PHLC. If you have specific questions for either Don or Micah, we'd be happy to forward those to them as well. And thank you again so much, Don and Micah. This is really both informational and inspiring. So I appreciate your participation and hope everybody has a great day. Thanks.